So beginning with an observational study in patients with congenital heart disease, there's a study of 25,000 patients that came from 3 different databases looking at the issue of sudden cardiac death. About 5% of patients in this registry died, of whom 20% of those were sudden cardiac deaths. And they looked at what were the predictors of sudden cardiac death. They found that having a history of SVT was a component. Also, left ventricular dysfunction, although they called it systemic ventricular dysfunction, as well as pulmonary ventricular dysfunction, so RV usually, were both independent predictors of sudden cardiac death. Also, long QRS duration as another factor, and QT dispersion. And thus they concluded that many of the risk factors were similar to what's seen with standard patients with left ventricular dysfunction, but that this carries over into congenital heart disease, depending on which ventricle, and thinking actually about both ventricles, as a way to risk stratify for sudden cardiac death. And so bringing in a new concern to monitor for in congenital heart disease.